Hi everyone, welcome to today's session at GSNMH. It's my pleasure to introduce our distinguished guest, Dr. Akshaya Kirti. Dr. Kirti has worked across some of the most respected institutions in healthcare, including Tata Memorial Hospital in medical oncology and pain and palliative care. He has also received intensive training in critical care, managing patients in ICU and CCU settings, and has worked in internal medicine at Netaji Subhash Medical College. Currently, Dr. Kirti is a postdoctoral research fellow in the infectious disease at the University of Louisville, while aspiring toward an internal medicine residency in United States. His academic contributions include publishing research, participating in grant competitions, and he is even launching his own clinical trial in oncology. Beyond research, Dr. Kirti serves as a guest columnist for OncoDaily and work as a physician-patient liaison for Arogya Vedya, an oncology teleconsultation platform serving patients in India. He also shares with us an honor of co-leading the Global Society for Neuroscience and Mental Health, where his dedication to bridging clinical excellence and mental health awareness continues to inspire. So please join me in giving a warm welcome to Dr. Akshaya Kirti. So over to you, Dr. Akshaya.
Thank you, Dr. Rajvi. That was a very kind introduction, and I'm always very glad to be a part of this organization, and because this is one of those few organizations where we don't talk like doctors. We actually want to bridge the gap between doctors and the actual patients which we see. So I think that's unique about this organization that everything is pretty straightforward, and anyone can tune in and learn something about some mental health disorders. And there are no much medical jargons, and it's pretty straightforward. And you're doing a great job leading this organization, and you're helping a lot of people. So I'm really glad to be a part of this. So yeah, thank you for having me.
Thank you so much, Dr. Akshaya. And we are very grateful to have you. And today's topic is PCOD and emotional well-being. So I will jump start with the question how do the hormonal imbalances in PCOD contribute to mood swings, anxiety, or depression?
Well, when we say PCOS, PCOD, so it's not just the ovaries we're talking about. It's not just irregular periods or having acne or having facial hair or hirsutism, which we say. It is, as rightfully described by one of my patients, I remember it's a hormonal roller coaster. That is
Yes.
the one term which I really like to describe how PCOS is. And you have to know that it really affects your emotional well-being, your mental well-being at a very deep level. If we go into a bit of a medical background, there is the male hormones, which are called the androgens, they are produced in excess. And these cause an imbalance in your estrogen, progesterone, and these excess androgens would also lead to something we call as the insulin resistance, which leads to like a diabetic like uh, phenomenon in the patient or metabolic syndromes in the patient. And now these hormones are the ones which play a very key role in this disorder. When these hormones fluctuate, they go up or down, they are not just hormones which are being affected. There are certain neurotransmitters, and these are very nice names thrown around in social media, and everyone knows these: the dopamine, the serotonin. These are the things that get affected. So obviously, if these are being affected, there is a mood swings that happen. There is irritability, anxiety, and in some cases, I've even seen patients having depression with PCOD. On top of the biological impact, everyone talks about it. You go to gynecologist and they're like, "I have PCOD," or you get ultrasound, you take oral contraceptives. But what no one talks about is the psychological aspect, and that's what we are here for today, the psychological aspect, because there is weight gain, there is acne, there is facial hair, and most importantly, a lot of people come with this concern to me that they have infertility issues. They're like, "Doctor, I have PCOD. Like, can I get pregnant? I want to have kids. I want to plan a family." There are people who have families. They want to get pregnant, but they are not because of the PCOD. This is not just a biological aspect. I have seen patients and people having their self-esteem get eroded, and it triggers a cycle of negative emotions, which ultimately leads to depression, anxiety. So when we talk about PCOD, we must remember that again, we are not treating just the ovaries, we are supporting the minds too.
Um, I appreciate like how clearly you explained that complex topic. And like with that said, like how do you think lifestyle and mental health are related? Like what role do exercise, diet, and sleep play in improving both PCOD symptoms and mental health?
Well, actually, this is one of the favorite things I like to talk about in PCOD. Like whenever we have any other diseases, let's say hypertension, cardiac problems, or let's say stomach issues, apart from medicines, we tell them you need to also do lifestyle management, you know.
Yeah,
But in PCOD, you need to do lifestyle management. Lifestyle management is not just supportive, it's not something you can or cannot do, it is the frontline therapy. So we have to understand that even before prescribing medicines, lifestyle management is the therapy, is the frontline treatment. Now, how it is scientifically backed up, whenever you have regular exercise, there is for all the doctors who are joining us today and all the medical students, there's a receptor called the GLUT4. Whenever you exercise, you run, you work out, these GLUT4 receptors get upregulated in your body, and these absorb the glucose. Okay, it increases the insulin sensitivity, which leads to decrease in blood glucose. And hence, a lot of other symptoms can be managed by exercising. And that's the reason we say patients who have PCOD should have very strict dietary restrictions. They should have regular exercise, workout. And there is a very important aspect apart from exercising that the patient should take care of is that they should have a very balanced, low glycemic diet. This will stabilize your blood sugar, and also it will stabilize your mood. It will keep you in a good mood. And the third pillar, so we spoke about diet, we spoke about exercise. The third major pillar is sleep. You really need to have some good sleep because poor sleep worsens the thing we are repeating again and again, the insulin resistance, which again leads to a decrease in cortisol, and it increases the cortisol. So there's a lot of hormonal imbalances which up and down with these kind of diseases. So you have to really take care of your sleep, diet, and lifestyle. Apart from that, then we move on to the medical therapy, which most of the gynecologists prescribe. And so again, to summarize, I think so that exercise is the frontline therapy. It's not just a supportive or something you can or cannot do. You have to do. That is
right.
really, really important if you're having PCOD.
Excellent points. You have highlighted some key takeaways for like all of us. So, like when it comes to lifestyle and mental health, we want to also know about the treatment and support. So, like besides medication and like what mental health interventions such as therapy and mindfulness practices can help women with cope with PCOD.
Okay, that's an excellent question. So, we all know about the medical therapy. So, mostly I'll just touch on it briefly that PCOD is managed through oral contraceptives in simple terms. I won't go into the nits and grits of the pills, but then in simple words, those are the oral contraceptives. But PCOD is not just about the pills. The one thing which really helps patients are the CBT, which are the cognitive behavioral therapies. These are the therapies which would help these women, these young women, refrain the negative thought patterns that are linked to their body image. Initially, we spoke how you have weight gain, you have acne, you have facial hair. So when you have these CBT, the cognitive behavioral therapies, these help you overcome the negative aspect you have regarding your own body image. And then you're obviously stressed about infertility, and there's increase in cortisol. So these help in balancing that as well. And then again, we have the mindful practices like having meditation, doing yoga. These will not just again upregulate your receptors and medically speaking, but these also help you balance the stress. And I remember one thing which really helped one of my patients was she found a support group on Facebook where there were women from the Indian subcontinent. They were suffering from PCOD, and they had made a support group on Facebook. They were from different parts of India, and they used to talk about what are they experiencing and how many days are the periods being delayed, what are the symptoms they're having, and what are they doing to overcome that. And some of these women from these group went on to lead other women to have a healthy lifestyle. And I think so, no doctor can do this. Okay, I being a doctor, I cannot do this. I can just tell you what to do, but it's these groups, okay, these support groups that come together and they help, like it's always said that a good society is your best friend. So similarly,
Yeah.
if you have a really good support system from the people around you, and that really helps. So I think so having support groups, finding people with similar disease patterns, that really helps. If you have a safe space to communicate what you're going through. So again, the goal is not just to control the symptom, but emotional resilience. We really want our patients to build that.
That's an amazing point, actually. So when we talk about like support groups, it has shown that support groups always helps, and different people's perspective is also there, and we find a kind of uh, um, sympathy, empathy with each other's stories. So thank you for sharing that perspective. And so I would like to ask when about this, like breaking stigma. How can we address the social stigma and self-image issues that women with PCOD often face?
Well, this thing is especially not noticed in just the rural parts of the Indian subcontinent or other nations, but I've seen it in even urban setup where women approach our clinic in confidentiality, where they don't want their spouses to know or the families to know that they're suffering from PCOD, just because of the social stigma. There are
Wow.
women who are very conscious about their body image and how they look, and that that is just very sad how much they have to suffer because of that. So, and one funny incident which I remember that just a couple of weeks back, one of my high school friends, she reached out to me and then uh, she said that, she was recently diagnosed with PCOD. And she's like, "Hey, you know what, Akshay, I don't think so. It's a big deal because you know what? All my friends have it. Okay." And I was just very shocked. I'm like, okay, PCOD is very common, but then why are we not doing anything about it? PCOD is not a regular thing to have. It is a proper disease. It's a disorder, and we should act upon it. And it is way much more common than we think it is. And the stigma associated with it keep the women silent. They are not able
True.
to talk about it. They're not able to discuss about it. I bet you there are not many organizations which talk about this. We all talk about cancers. We talk about lung disease. We talk about the heart. That's the favorite topic for doctors. But no one
Yeah.
talks about PCOD. There are no organizations for that. So I think so the whole dimension of the conversation should shift more towards an education, which will bring the whole mindset from biology, from the blame. The women are
Mm.
not to be blamed. It's biology. They don't have to share the blame. And from judgment, we move on to support. This aspect will come when we start educating people. So I'm very glad that some of my friends, me, and there are certain organizations I'm part of. They go to schools, they go to rural setups, and they talk about these. They educate people what is PCOD, what are the symptoms of PCOD, and how easily it can be managed. And these are the things we need to work on rather than being very aggressive about the treatment. We always say prevention is better than control. So we should go ahead, talk about it, make sure that the society is a safe space for the women to come up, express that they are suffering from this, and let us be the people who can help them. Let us give them that safe space and not indulge in the stigma which is already associated with it. So let's empower the women to seek help without guilt.
Yeah, thank you so much for bringing this topic, because actually no one talks about it, and in my circle, many of my friends have PCOD, and I have like seen them not talk about that, and they feel very stigmatized when they are talking about that. So I guess and even though it is very common, it is very less common when like when people talk about it, and when they want to express themselves and everything. So PCOD is something that we should start talking about, and the mental health effects of PCOD. It leads to us our last question, and long term perspective. So like, what steps can women take to maintain mental well-being while managing PCOD throughout different stages?
What makes women unique is the hormonal up and down that they have to go through when they have the regular menstrual periods, they have the pregnancy. It is a lot of ups and downs they're going through. Now, in that mixture, you add PCOD, it is a living hell for the woman. And I always say prevention is better than cure. So, PCOD, you have to understand it's not something which happens in a day. It is a chronic condition. It is a chronic condition. But what I feel is that with the right strategies, with the right kind of lifestyle management, as I said, it is the treatment. Lifestyle management is the frontline therapy. We can easily avoid and control PCOD. Like in adolescence, we are educating children on what is PCOD, what are the ways they can avoid it. If they have it, what are the things that they can do to get better, and how easily we can deal with it. And during adolescence, early education, reassurances, they are the key to preventing the body image issues and anxiety because these are the adolescent years where you have the peak of such insecurities. Now move on to the reproductive years. Here we should support uh, with the concept of fertility. We should not dwell into the insecurities of not getting pregnant because most of the women in the reproductive years, the main concern is to get pregnant and they face a lot of social stigma because of that. So we should provide support around fertility, menstrual regulations, and mental health screening. These are very crucial in the reproductive years. Now move on to the perimenopausal and beyond period. People are experiencing PCOD even in these age groups. Here, we should really pay attention to the metabolic health because the women are suffering from other comorbid conditions in this age, and there are cardiovascular risks involved. And so, we should always focus on the continued emotional well-being of the patient. And I remember I wrote a paper about it once where we discussed about how PCOD can lead to certain type of gynecological cancers or malignancies. So PCOD is not the end of the story. It opens the door to a myriad of conditions which are much more fatal and unforgiving. So regular follow-ups, multidisciplinary care, which is very underestimated, like having not just the gynecologists involved, but having endocrinologists and dietitians, and definitely mental health professionals very early on from your diagnosis. You should not wait for things to happen because mental health issues are associated with PCOD. So you should involve a multidisciplinary care for the patients as early as possible. And there are certain foundations, certain groups you can reach out to who can help you out. And we should encourage women to build self-care routines because the women are so involved in taking care of other people that they forget about themselves. They're like, yeah, we'll deal with it. It's okay. And by the time the symptoms starts to occur, it's already very late. Like you are taking pills, you have a very difficult time having your mental well-being. So I would always really request women to emphasize on their self-care routines. They should build their own support networks and they should have their own coping mechanisms so that we ensure that they will not only manage PCOD, but they will thrive with it. And
Mm,
just a final thought that PCOD, as much it is a biological issue, it is a very major psychological condition. And we should not ignore that aspect. And as clinicians, it is our responsibility to not only regulate the hormones, but we should also restore hope, confidence, the quality of life in such patients. Treating ovaries is important, yes, but healing the mind is what will transform the outcomes. I have seen patients who have counseling sessions with PCOD. They have such a nice outcome.
wow.
So, yeah.
What an amazing insight, actually. And like you very well said that women are so busy in taking care of others that they forget to take care of themselves. And we didn't know about how PCOD can in the long term and everything is can be connected with some malignancies and cancers. So and mental health and people around women need to know that they should be given the priority for themselves as well. It's an amazing insight. Thank you so much, Dr. Akshaya Kirti, for sharing your valuable insights today on the intersection of PCOD and mental health. From explaining how hormonal imbalances affect mood to highlighting the importance of lifestyle choices. For example, exercise, nutrition, and good sleep. You have helped us see the PCOD in a truly holistic light. Your guidance on mental health interventions from therapy to mindfulness and your thoughts on breaking stigma around PCOD have given us both practical tools and hope. Most importantly, you have reminded us that women can protect their mental well-being and find balance at their every stage of their life. So let's carry forward today's message. Managing PCOD isn't just about a physical health; it's about caring for the mind and embracing compassion for ourselves and others. So let's keep that in mind. And with that, we would like to conclude our session. And your last words, Dr. Akshay.
Thank you so much, Rajvi. It was very well summarized, and kudos to you and the organization who are taking such initiatives to address such concerns which are not very highlighted in the medical aspect or by the various societies. And I would request people watching this, if you are suffering from PCOD or mental health issues, or if you know someone who is suffering, kindly reach out to certain organizations, and you can reach out to our very own, the Global Society for Neurosciences and Mental Health, and we have people who are going to take care of you. We can provide you with proper guidance and help. So please do not hesitate. Everything will be confidential. So you can reach out to societies like this. And uh, lastly, I would like to congratulate Dr. Rajvi for doing such an amazing job on addressing such things in our society. And it is really which is very concerning for me. So I know a lot of people going through this, so I can personally relate to what is happening around. So thank you once again for having me and taking out the time to conduct this session and addressing this issue. So thank you so
It,
much.
it's our honor actually to have you, and so thank you so much for this session. And with this, we will conclude this session. And yeah, thank you so much. Bye, everyone.